You can start, Sonam.
Actually, we haven't gone live yet.
Hello, Soluji, can you please start? We are already 51 minutes.
Okay.
31, yeah.
Hello, and a very good evening to you all. Myself, Solu Gautam, and today, on behalf of Mero Eye team, I'll be hosting this session, and I extend a very warm welcome to each one of you who have been connected with us through our iTalks webinar. Well, I would like to thank you all for taking the time out from your heavy schedule and marking our program with your glorious presence. Thank you for joining with us this evening, and don't forget to subscribe our YouTube channel for being updated to our programs even in the upcoming days. For now, I would like to step forward to inaugurate today's session, and also I would like to let you all know that we'll be having our discussion session at the end of the webinar. So if you get any queries in between the session, just drop them on our comment section. We will get back to you later on. With an extensive growth of technology, the use of telecommunications to deliver health-related facilities has evolved drastically. These interactive technologies have the potential to provide great benefits alongside reducing costs and increasing the convenience. Despite the advantage, its use in optometric practice is still minimal. Today with us, we have our delegate, Dr. Ajeet Bhardwaj, who will be talking particularly about telehealth and optometric practices. Before that, I want to shed a light on his general introduction. Dr. Ajeet has graduated as an optometrist from AIMS New Delhi, and later he completed his master's in optometry from Lotus College of Optometry, Mumbai. He is the founder and director of Optic in Vasant Vihar, New Delhi, and he has built his interest in developing telehealth practice so that he can stay connected to his patients while being away. Welcome, Dr. Ajeet, for today's session, and it's a pleasure to have you with us. Hello, Dr. Ajeet. Do you hear me?
Yeah, I can hear you. Yeah.
So now it's over to you. You can proceed with the session.
Okay. Well, I would like to thank Mero Eye Foundation for inviting me to speak to all my friends in Nepal and India, and I think people are joining from Malaysia as well. Good evening to everyone. And my interest in telehealth or teleoptometry goes back because of I'm an optometrist by profession, but at the same time, I am a tennis player, and I happen to represent India in Indian tennis team. And that made me to travel out to play such national and international tournaments all over the world. And I happen to visit most of the time to different locations. And to stay in touch with my patients, I was thinking a way to connect with my optometrist while I was playing tennis outside India or outside of my practice in Delhi or wherever in India where I traveled. And that brings very close to my friendship with Nepal, because the last time I happened to play, a good friend of mine who is I think he's a powerful minister in Nepal. His name is Kamal Thapa. He's a very good tennis player too. So it's very nice for me to connect with all of you, and I would like to share that whatever I have gained in telehealth or teleoptometry, so that optometrists today can implement in their practices and adopt telehealth, because post-COVID, it has become very relevant. It's a subject of interest for all ophthalmologists, for all optometrists, for all healthcare providers, for that matter. And it's not something. The subject is not new. If I go back to the history of telehealth, we go back to some things like 1876, when the telephone was invented, people thought, this will bring down the, even there was an article in the newspaper called Lancet, which stated that the doctor's visit because of telephone has been reduced. And we followed soon in 1906. First time ECG uh, was sent to a doctor via telephone, via telegraph. And later we saw that by 1950, we saw emergence of telepsychiatry, where psychiatric consultations were given. Later, after 10 years, we saw teleradiology coming up. And then in 1980, we saw telepathology, dermatology, and by 2010, 2015, we saw teleophthalmology emerging as a field. The reason being, if you look at the eye health, the digital images, if we see the subject as such, after radiology, ophthalmology is the second healthcare profession which takes maximum digital images of the part of the eye. And that is the reason that teleophthalmology has become more of importance. Because in telemedicine, what we previously called telemedicine, if you break this word into two, tele means distance, it's a Greek word. And the second word is medri. It's not medicine, it's a Latin word which means from distance. It means getting relief or getting treatment from distance. That was the mere or the basic layman's language, that patients could get treatment from distance. But over the period of time, what we felt and what we saw emerging telemedicine emerging as, it is basically digital images are transferred by use of communication technologies to a doctor, to a healthcare provider who is not in the same locations. I'm not going by book. My I have written a book on this, and I think you should know. You should try and read this book, and this book will give you the details of the definitions given by WHO, given by Ministry of Health in India, and you can see. But what I'm trying to explain it to you, basically, use of digital images to be transferred to a different location, to a healthcare provider, to get detection, to get diagnosis, to get treatment, to get management, to get prevention, to get health promotion, to get education. So this is all basically telemedicine covered. So I would suggest that if you want to look at the exact definition, get this book. This book is available on pothi.com, or you can contact me for the book. We can send you the book. It's an ebook which has recently been published. And what happened is this, that later people felt that telemedicine was just a very restrictive word, and they needed a broader definition of telemedicine which covered clinical and non-clinical. So they decided that they will call, or they decided that telehealth, which is a broader term, which encompass both clinical as well as non-clinical findings. So telehealth is more inclusive terms in that sense. So that is why most of the time what I use word is telehealth, because it covers teleconsultation, it covers telecare, it covers telecommunication. So telehealth is the technology which I will be using in which I have used in my book, and which I'll be using in my communication with you all. I've told you about the history. If you look at what happened after, I think that in India we had a lockdown, say around 20th of March, and that's followed all over the world within 1 week this way, 1 week that way. And this lockdown made us to believe or trusted this technology on us. We were thinking that this will be a futuristic. This is something what we will see in future. But if you look at the number of telehealth consultations, from it was 2015-16, we were about 15 million telehealth consultations. And By 2020, pre-COVID, we saw 36 million teleconsultations. And within 1.5 months, we saw the emergence of 200 million teleconsultations happening all over the world. So you can just imagine that this is the industry where every healthcare provider is focused upon. This is the industry, if you look at the stocks of the companies who are investing in telehealth technology, telemedicine technologies, their stocks have risen to a very high level. Almost they have gone up, from 15, $14 to almost $245 of a company in US. So telemedicine has become a great kind of focus for a healthcare provider, not just because of the technology point of view, but because of the safe distancing, because of the need of the hour. And this is where I want optometrists to be concerned, in the sense that they are going to be at the forefront of the technology, and they are going to be the primary eye care practitioner, and they will be the first point of contact. And they, sooner or later, and the India as of now, the telehealth consultations is going to happen through ophthalmology, but they will be connecting through healthcare provider like optometrist, or maybe to another healthcare provider. I will give you detail about it. So the technology is going to change the future of eye care. We will need to have more and more clinical skills to develop and see how we can examine our patients using the technology. And this is what we have to adopt in our practices, which has been a different way of conventional. I call it conventional because this is what we were doing earlier. But now we need to see that how we can diagnose, how we can treat, how we can see, how we can detect all the diseases sitting remotely. Coming back to the future of telehealth is going to be dramatically changing the eye care industry. There are companies, I will mention you about some companies like 2020 Now, and there's another company called Globe Check. These companies, they have invested so much of technology that within 15 minutes, a patient can get all his eye examinations, including the subjective objective refraction, including the eye pressure, including the OCT findings, including the retina exam, and 13 tests are done and sent to an ophthalmologist, and who diagnoses what needs to be done. And then these tests are given to the patient as well as shared to another practitioner close to his community. So you can see within 15 minutes, without dilatation, without any use of any anesthetic, without any use of any mydriatic, without any use of any drug, patient's eye health is evaluated in a comprehensive manner. And this is where the technology is going. There's another company which is invested a lot in optometry called Digital Optometrics. What happens even in today that most ophthalmologists and some optometrists, they travel to different practices. So thereby they install certain equipments, they upgrade your equipments, whereby optometrists sitting in one location can provide consultations after getting all the comprehensive reports to him from one location. So this is something which is emerging. This is something which is going to change the way eye care is going to happen in throughout the world, as well as in our country, basically, as well as the same thing with Nepal, that healthcare is going to change the face, and telehealth will be a catalyst in that process of change. Well, looking at the how do we connect? Well, there are two ways of connecting, because even if you go back, and most of us use this technology to talk to our friends, we used SMS, we use WhatsApp, we use FaceTime, we use Facebook Messenger to see each other and talk to the person. So same technologies are used in even in healthcare. Same technology are adapted in healthcare too. So looking at technology point of view, looking at descriptive point of view, we have two kind of e-consultations, what we call e-visits, or you can call it e-consultation. One is called synchronous. As the word says, synchronous means the patient and the healthcare provider, your doctor and the patients can see each other face to face and talk to him, talk to patient, talk to each other in a live.
Excuse me, doctor.
Yeah,
So doctor, can you please make sure that your screen is full screen? Uh,
sorry,
can you please make sure that your slide is full of screen?
the slide. Okay,
Yes,
I have to.
you
Okay,
can.
because this is I'll be talking and then I'll go back to the next one because there's nothing because this is something this history of telehealth. So there's nothing
Okay,
much. So
okay,
I'll be explaining the other slides at the later point of time.
okay, doctor. Nice.
Okay.
Okay,
So one is synchronous mode of communication. In synchronous, your patient, and optometrist or ophthalmologist can see each other, can talk to each other, and do a digital exchange of images, digital exchange of communication, digital and treatment can be given to the patients while the patient is there. So it means it's a live but a virtual consultation. This is called synchronous. And asynchronous is something you download and forward, like some technology like SMS, which is not real time, a technology like WhatsApp or the email, whereby you can write your symptoms, you can send your pictures, the picture is downloaded and sent to the ophthalmologist or to the optometrist, and optometrist or ophthalmologist sees at his own convenience and provides the treatment whenever or within 24 to 48 hours. So there is a synchronous and asynchronous. Synchronous is something where you and the patient are face to face, connected virtually. Just like I think Kapil is connected face to face. Similarly, this is called synchronous. Asynchronous is something whereby you download a picture, you download your symptom, you write your symptoms and send it to ophthalmologist, and ophthalmologist writes his prescription and send it back, whereby there is no verbal or there is no live communication. That's called asynchronous. Synchronous mode of communication, synchronous is more expensive. It costs more because patients and you are live, but asynchronous are cheaper consultation. Asynchronous consultations are normally used in radiology, while ophthalmology, we prefer to use synchronous mode of communication because most of the time patients will come to us for certain kind of emergencies and they would like to see the doctor immediately. So synchronous and asynchronous. While you can choose a hybrid model also, whereby you can decide with your healthcare provider that you can do part of the synchronous and part of asynchronous. So there are hybrid models also. And in telehealth, we use remote monitoring of your patients, certain chronic conditions like diabetes, like hypertension, whereby you need monitoring, and telehealth provides the tool for monitoring of your health condition. Well, I've told you what is telehealth. I've given you a bit of history. I've told you what are the various types of consultations. As I told you, in two-way communication, most of the healthcare providers, we have three kinds of platform. One, which is we already on, which is most popular in this part of the world, particularly in India, and I'm sure in Nepal also. Zoom is the most popular healthcare platform being used for telehealth. While in ophthalmology, this in other parts of the world, there's another program called Eye Care Live. In Eye Care Live, you have a provision whereby a patient's vision can also be tested by the platform. And it has a dry eye questionnaire whereby dry eyes can also be objectively estimated, whereby you can come to know from the symptoms of the patient whether the patient has dry eyes and you can provide the treatment. So iCare Live, Zoom, and DoxyMe. DoxyMe is a platform which is very popular in Australia, and most of the optometrists in Australia, they use Doxy.me, but in India and in most part of US, people use Zoom and they find it very comfortable and convenient with this platform. Well, when you connect, there are certain protocols, just like I'm communicating to you. Similarly, your patients will come to you and connect with you on the similar platform because they want to see you, you want to see your patients. So first thing you have to make sure I'll give you certain step-by-step links, step-by-step guides. How do you communicate with patients on Zoom, and what are the precautions you need to take care? What are the, preparation you need to make? The first thing what you need to do is this: whenever you are communicating with the patient, make sure to get the identity of the patient correctly, because sometimes you may get a wrong patient in there because your link, your meeting ID and password doesn't change. So a patient whom you have given time, and you may be surprised that some other patients may get in at that particular time. So make sure that first when you join in, just like I introduced myself, that who am I? Similarly, as a healthcare provider, you have to make sure that first thing you need to do, you need to introduce yourself. Look, I'm so and so. This is my qualification. This is my experience. This is my registration number with my council, if you have a council in your country. This is my experience. This is the place I practice, and I'm very happy to connect you and provide you my consultation. So this is going to be the first step of your consultation. Get the identity from the patient also, to make sure you are treating the same patients. Make sure that the history of the patients and all details are with you when you start the protocol. Make sure that you are well dressed, you are speaking in a very mild tone, you are not speaking too loudly. At the same time, your camera should be at your eye level, because if you feel that the camera is slightly lower, put some books below your camera, below your laptop, and raise the level, and see that you and patients are advise the same to your patients too, because you need to examine them in detail. You need to see them face to face. You need to see their eyes also. Make sure you, whatever time may be, because sometimes you connect to patients at a different times because there is no barrier. Patient is connected to his home and you are sitting in your home. That doesn't mean that you don't dress up well. Make sure you comb your hair. Make sure you look fresh. At the same time, make sure there is a privacy with the patient. Assure that the patient is comfortable. Make sure, tell him that your health records, all your problems are between me and you. Make sure your children, your other family members don't disturb you while you are communicating with the patients. So these are certain things, certain protocols you must maintain for a good professional, ethical meeting with your patient. This is the kind of impression you have to give it to your patients, and for which is very important that you maintain certain protocols. And if you go back to my book, if you read the book, you will find them in great description. I've written step-by-step method of connecting to your patient. After that, I will come back to how much does it cost to connect. Everyone thinks that telehealth is a very expensive proposition because it sounds, something with a lot to do with technology. But let me tell you, it doesn't cost any money to connect. The Zoom platform is available free of cost to up to 40 minutes to any patient. So you can get connected to the Zoom without any cost. The instrument, you don't need any special instrument to connect to provide basic level of teleconsultation. You don't need any kind of software to get payments. Today, with so much of technology, so much of banking systems being relaxed, online payments happening, your debit card company, your credit card company will be very glad to work with healthcare providers and give you the links which you can send it to the patients, and you can get payments from the patients without any hassle of going to the bank, or just work with your companies, you will work with your banks, and they will be able to provide you the link for that. So what it needs is more of a will on part of optometrist and part of ophthalmologist to make sure that they are able to adopt the technology in their practice. How patients get benefit from telehealth? What we need to understand, the amount of time you spend in communicating. Your patients spend at least 2 to 3 hours by road coming to your office, and then they wait in your office. Third, besides the wait, you have an attendant in your office, and the fourth, the amount of risk you carry to spread the virus from you, from your healthcare provider. Everyone is at risk. So looking at all these things, we realize that telehealth is going to stay, and telehealth is something which is going to be the future of eye healthcare. Many of us on 25th of March in India, MCI, they relaxed or they gave guidelines for telehealth. It means there's a new notification, there's new amendment in the medical law or medical act, which allows all healthcare providers, not all healthcare providers, but those registered with Medical Council of India to prescribe, to diagnose, to treat the patients in this manner. I'll tell you, I've gone through the MCI guidelines, and these guidelines are very, very friendly to doctors. Why I say very friendly to doctors? Because if you practice physically, in the state you practice, you have to register in your state. You cannot practice in another state and, your registration must be in that particular state where you are. But in telehealth, you can be anywhere and you can provide consultation to any citizen of the country anywhere in India. It means you just need one registration to serve all the patients across India. So it is something which opens up the borders. You may be sitting in Delhi and you can be treating a patient sitting in Darjeeling or sitting in anywhere in India. So this gives us a very broad kind of openness to all the doctors. Second thing, what the law is that there is no issue. Like if there is a professional, there's a kind of small error on the part of the clinician. If there's a mistake by the doctor, a patient cannot take him or cannot sue a doctor, which is a normal trend emerging in some of the countries. So in India, all the healthcare providers, all the doctors are exempted from, or no one can take them to the law, to the court of the law for their small negligence, which has been done inadvertently. It could be a kind of wrong clinical decision made by a doctor in the best interest of the patient. So why I say it gives a leverage to the doctors not to be so scared of the technology and practice their clinical skills. There should not be gross negligence on the part of the doctors, because they have to be clear that before they prescribe medication, they must make a provisional diagnosis. They must make sure that they diagnose before they provide any treatment. And their list of medications, their list of drugs which they can prescribe and which they can follow. You cannot just give any medicine to anyone. I'll tell you exactly what I mean by it. So there are going to be two kinds of consultation in telehealth. One is a patient we call it a first consult, means a patient is coming to you first time for a fresh symptom. So when I say that the patient is coming to you the first time, means that you and your patient have seen each other, have understood the problem, and this patient, if he develops another problem, he cannot be called the second consultation or the follow-up consultations. For a new problem, he will again call we will call it again the first consultation. The first consultation can be remain valid for a period of 6 months. You cannot extend the first consultation that the patient comes in the first consultation is valid only for 6 months period of time. Thirdly, that if a healthcare provider has forgotten or doesn't remember seeing his patient and he cannot remember what treatment he gave, maybe he has lost, he has forgotten, he has not kept his records, or maybe the records are erased because of certain technology failure. In that situation, it will be called a fresh consultation or the first consultation. For a follow-up consultation, it's important that the follow-up consultation is used for the treatment of chronic diseases like diabetic retinopathy, like asthma, like any other chronic disease, whereby a patient has to be seen by a doctor face to face, and then he can get the treatment follow-up within 6 months of time. But again, as I mentioned, that after 6 months, it will again, the patient has to be called up again and he has to be seen physically, and so that the follow-up consultations can be considered. The first consultation, not all medications you can give. There are list of drugs that has listed upon in the Council Act, in the amendment, which states clearly that we have the list O, which is safe drugs, which are called over-the-counter drugs, which can be given to any patient anytime, whether it's a first consultation or second consultation or follow-up consultation. Then there is a list of drugs which are called list A, which is only given for the first consultation, only with a patient who has seen you on a two-way video conferencing. It means you and your patient have seen each other on a video mode, not just on a verbal mode. That means, if a patient has a conjunctivitis, he must see a doctor for getting an antibiotic face-to-face, virtually, on a two-way video conferencing, not just by a telephone call. And list of B drugs are used for follow-up consultations. As I mentioned, list B is used for treatment of chronic diseases like treatment of diabetic retinopathy, glaucoma, and glaucoma medications. So you have to be clear that there is a third or the fourth list, which is called prohibited, which are banned for telehealth consultations. And this is something which one should avoid or one cannot use. These are antipsychotic drugs, which are normally used by psychiatrists and all. So this we should avoid. Doctors cannot prescribe X drugs or list X, which we call it, or scheduled, which we say that these drugs cannot be prescribed to the patients. So this is something what, as I mentioned, that these are the protocols which MCI has given. It makes the practice very easy, very convenient to the patient, while there are certain restrictions to the doctors. And the restrictions are that you cannot do any invasive procedure or any surgery remotely. You cannot use telehealth consultation for research and evaluation. And you cannot use telehealth consultation for patients who are not residing within the country. What I see is this: I have done about 150 telehealth consultation in last 2 months. But there is no way you can find out whether the patient is calling from Nepal or calling from India or calling from Germany, because we don't have the technology to identify until unless we give it to certain expert to identify where the person is calling from. So the government needs to look at these laws, that these are certain things which are not practical, and those things which are not practical, they need to be deleted, because I see India as emerging as a health destination to many countries, to most of the African countries, most of the Middle Eastern countries, and patients do travel to India for treatment of chronic diseases, which can again be handled by telehealth consultations. And I'm sure the government in time to come will amend this law. And those countries who accept our prescription, they should not have any objection in providing the treatment to those patients. So this is something what I have given you the background. You know, looking back, what we were doing earlier. Earlier, telehealth meant, opening a vision center, putting a vision technicians in the front, getting the images from there. Mainly, the telehealth was just for a kind of rural reach. That is what telehealth has been practiced in India pre-COVID. The big NGOs like LB Prasad Eye Institute and you know Aditya Jyot and Shankar Netralaya, they have Arvind Eye Institute. They have many vision centers, and they connected their vision centers to get mainly the referral for cataract and maybe treatment of refractive error by placing a vision technicians at the telemedicine center or maybe at the what we call vision center. And patients were basically for to avoid their communication, to avoid their travel to base hospital very frequently. This was the basic application. But today the technology or the face of telehealth is different. Today patients want to come to a place which is safe. Patients wants to be treated at his or her own convenience. Patients want comfort of their own house, and patients wants to be empowered that they can have second opinion, they can have third opinion, they can have as many opinions through use of telehealth. So the face of telehealth has changed, and this is an opportunity for every optometrist to make sure that they implement, they be a part of telehealth consultations right from the beginning. Because you are the first person, you are the first point of contact for any patient. Patient come to you for whatever may be the disease, but they come to you first, and you should be able to position to decide where this patient needs to be referred to for any medical need. And you must be able to connect to ophthalmologist, you must be able to connect to specialty ophthalmologist, and you must be able to provide your patients with this kind of service by implementing all the steps what I have told you today. It has a vast application for optometrist. Starting from, I will start now. What are the applications? I'll come to sorry, but this slide has been there for a long time. So let me just change my slide. See, this is what I meant by remote. This is something what, suppose you have to mark a patient's PD and you don't have the patient with you. Patient is at home. How do you measure the PD of the patient? Just ask patient to simply put a scale over your head like this and put the glasses, and you get the image, and you will be able to mark the PD without any issue. You don't need to go close to the patient. You don't need any PD meter. You can mark what could be the height of the segment. You can mark what should be the diameter of the lens to be ordered for the progressive lenses. And you don't need to call the patient in your clinic for this application of for taking the measurement of the progressive lenses or for any other lens for that matter. This is what the same thing what I've just mentioned. The other applications what we find is just that if you just look at this, this is what we can use this technology to. Can you see this? You see, this is the technology whereby a patient doesn't need to try anything. You can put your inventory, you can put your optical frames online and send these images to the patient, and the patient can try that picture without even really trying those frames. See, we just did with 2 of them. Can you see this? Send your patients, get your picture. So technology is something whereby an optician can just put his view of the inventory what he has without sending the frames. He sends his gets the either the photo of the patient or sends his file to the patient, and patient can try looking at this front angle, looking at the side angle, and this is something an opticians can adopt into their practice. What I mean by applications for optometrist, you know, patients can be sitting in their home. You connect to the Zoom. You have the vision. We have the vision charts, which can be for 10 meters, which can be for 6 meters, which can be for 3 meters, which can be for 1 meter, which can be for 40 centimeters for reading. And you can measure the patient's vision while the patient is at home and you are at your clinic. This has a great applications for public health perspective, whereby patients could be in a remote town, in a remote area, in its rural vision center, and you can be sitting in Kathmandu or Pokhara and you can check patients' vision without you being there physically. Besides your vision, you can measure the contrast. We have the chart for the contrast sensitivity. We can measure whether the patient has astigmatism or not. We can measure the astigmatism. If the patient has astigmatism, you can see the reflection in this through the computer. You can use duochrome. You can measure whether the patient is overcorrected or undercorrected. You can check the color vision. You can measure this. We have 28, 38 slides of this color, and you can detect whether the patient has red and green or blindness or some neurological issues. This is your Amsler chart, which we portray, which we send to the patient, and patient can just look at this center dot, and we can detect if there is a central vision loss. This Amsler, we have made it in 3 colors, which is red and black, which is blue and yellow and blue, which is mainly for glaucoma, because patients have like for neurological issues they have different vision loss, while patients with glaucoma they may show more in this yellow and blue. This is a desaturation test to see the optical, to see the condition of your optic nerve. You can compare the right eye, you can compare the left eye, you can just check if there is an intensity difference between the two eyes, and you can decide that yes, this patient has problem in this particular eye and by how much degrees. You can measure all your binocular functions. You can do the ocular movement, you can do near point of convergence, you can do confrontation, you can measure central field, you can measure peripheral field, you can do all this while patient is at home. Patient is thousands miles away, and you, with your little bit of experience by implementing telehealth, can do this practice with all these tests very satisfactorily. Those patients who need your treatment for dry eyes, those patients who need treatment for red eyes, you can connect to them with ophthalmologist. Patients requiring any retinal conditions, patients requiring any visual field loss, you can connect to them. Patients having neurological issues, we have a flow chart whereby by doing certain flow, we are working with some good neuro-ophthalmologist. We are creating a flow chart whereby you can come to know whether the patient has a neurological issues or patient has just a visual field, double vision, maybe because of the binocular functions. So we have 2 flow charts, one flow chart for the dry eyes that you can come to know whether the discharge could be because of allergy or whether it could be because of any bacterial or viral infection. So the issue is just that the clinicians, they need to develop their skills and work on the skills because they are using a technology which is different from what they have studied in the school. So what we are suggesting is that improve the clinical skills, clinical judgment, and clinical enhancement of optometrists is more important. It's very important to implement telehealth in your practice. And this is what we have been working on. If you look at in last 1.5 months, we have done at least 10 webinars on telehealth, on telemedicine. And we want to make sure that we continue to do that so that the optometrists become a part of it. Because if you are not the part of it, you cannot help the system. Because you have to make sure that you are at the forefront, whereby you can get the consultation from you can get the consent from the patient, you can get all the EHR, you can get EMR, you can get all these tests done. And when the patient needs referral, you provide this referral to ophthalmologist, you become part of the treatment plan with ophthalmologist, and it helps you both ways. You are serving the public, at the same time you are providing your patients with the best of the treatment what you have not been provided in the past. This is what we do for fluorescein evaluation. This is some screen you send it to the patient. And what we do is just that for certain procedures, I'll tell you, there are certain for diagnosis is fine, but there are certain tests like refractive error calculation. You have measured that, okay, fine, this patient has vision of 6 by 18, 6 by 12, but what do you do next? We have worked with certain devices, certain peripheral devices. I'll share with you, I will show it with you. And we have developed confidence in those devices, whereby we send these devices to the patient's home, and patient's vision is corrected based on the output. I'll show you 2-3 devices here. This is something which I use. I send this device to my patient, and what it does is this: suppose the patient has 6 by, can you see it? I'm sure you can. This patient can rotate looking at the vision chart from a distance of 10 feet. You focus, patient focuses that, and wherever he focuses the best, the reading comes here. There's a scale here, and this can give you whether the patient is myopic or whether the patient is hypermetropic or patient has astigmatism. And we can come to know and prescribe glasses to him based on this device. It just takes 1 minute to decide to calculate the refractive error. When we find that this kind of device is not so practical, we have devised another method whereby, you see these two, it looks very simple. All your powers starting from 0.5 to 1, 1.5, 2, 2.5, 3, all the diopters are here. We send this to the patient's home, and what we do is that we ask the person, okay, wherever you find the best vision correction, you stop, and this is where you come to know an approximate power of his subjective refraction. We have this up to the power of 15. Yes, 15. And this is what we do for, we have this for minus, and I misplaced the one which I have for plus also, which is in a black. So this is what we do for distance correction and reading correction. And then we have some astigmatic lenses, which becomes like a clip on this. And this is what we use it for getting the exact prescription of glasses. So we have one device, we have two devices, and third one I will share with you. These are self-refractive device. This is a company called Vision Check. I'm sure if you have interest in this, you would have seen it on the. This is a small instrument that get attached to your mobile phone, whereby by downloading the app and doing kind of synchronization of red and black lines which comes in this at different angles, you can come to know your spherical power, you can come to know cylindrical power, and you can come to know the axis. So we can come to the final prescription of glasses, final prescription of contact lenses. We can measure the corneal diameter. We can't measure the corneal curvature. So we can dispense glasses, we can dispense contact lenses. For dry eyes and red eyes, what we have is we have a small magnification device which gets attached to the mobile phone camera like this, and it has the light. It has then it has the blue light also, which is UV light. This is for evaluation of contact lenses. This is for the dry eye. We send this device, which we call part of the ophthalmic kit. and we send the fluorescent strips so that if there is a foreign body, if there is a dry eye issues, that can be evaluated with these two devices. So the technology is here. Only thing is we need to learn and we need to adopt this into. This is what I was telling you. The black one I saw is lying in front of me, and I. So these are the two. One for red, one for myopia, hypermetropia, distance near corrections. Both are done, and then we have some astigmatism, astigmatic lenses which gets clipped on like this. I'll show you which is the way it gets clipped on, so that you can come to know if there is cylindrical power. We just attach it like this. It comes at a 90 degree, it comes at 180 degree, and we come to know, suppose it is -2 with -1/2. We have this is -1/2 at 180. Then we have another lens which is at 90 degree, and we attach it, and we can come to know the cylindrical and spherical power accurately. We have done out of 150 about 25-30 refractions. Never just one case we have felt a difficulty. Otherwise, about 28-29 cases we did it with great satisfaction, and we have no issue in making even the most expensive lenses sitting anywhere to any patient in any corner of India or any corner of the world, as long as we can send these devices. Well, coming back, how do we become part of it? I would suggest that every optometrist should be in tune with or should adopt telehealth. You can do it right now. The telehealth consultation doesn't need, if you don't want to get a training, you said, okay, I just want to become a part of a referral plan. We have a plan whereby you don't need to invest in any of the training part. You just be a kind of contact between your patient and ophthalmologist, and you can do that. That does not need any training part. But what I strongly suggest is this, that since you are a healthcare provider, you must make sure that you use your clinical skills to make sure that you can serve your patient in a satisfactory manner by learning those skills, by learning those methods, which I have just shared with you. This is something which we do it for measurement of binocular functions. And this is, I told you about this technology, which is the future of this. This is my email number, and this is my WhatsApp number. If any of you have any question, if any of you want to adopt telehealth, how we can do it, what we need to learn, as I mentioned, you can learn in three ways. One, basic learning does not, whereby you can just refer your patient, does not require any skill to learn. You can be part of telehealth, whereby if any patient come for any maybe red eyes, maybe a kind of lid lesion, you can connect to an ophthalmologist and be a part of telehealth consultation. But if you want to learn few of the basic telehealth, what basic means, red eyes, dry eyes, your cataract identification, your central visual field evaluation, and lid lesions. So these are 4-5 requires a basic level of understanding, basic level of training. Then if you come to advanced level, whereby you need certain devices to practice, just like what I mentioned, if you need a device like for refraction, you need certain devices, you need a software, you need these all the slides. You don't need all those instruments in your clinic. You can just connect to your patients and send those two devices to the patient's house, get the evaluation done, get those devices back, and you can prescribe. If you want to buy an auto refractor today, it may cost you 2.5 lakhs of rupees. So these are devices what we have created around for peripheral vision testing are just very, very nominally priced, reasonably priced, so that our public, our vision health centers can afford it. And this telehealth has a lot of application in a country, developing countries like India or Nepal. If you look at our structure of public health, we have 20 tertiary centers which we have already made. We have 2,500 medical colleges, which we have 200 medical colleges which we have already made. We have 2,500 district hospitals which we have already made. What is lacking is 25,000 vision centers. And we cannot make it, let me tell you. Whatever government may say or government may try, whether it is India or Nepal, to meet this rural health challenge is not possible by creating a human resource at this pace. We can never meet that challenge for another 20 years. The only way what we can solve a public health problem is by accepting, by adopting the technology of telehealth and artificial intelligence. The things what we are doing, what we are teaching today, tomorrow we will make sure that we convert into artificial intelligence. We make sure that we eliminate this human process whereby your vision will be checked remotely by using the artificial intelligence, what we are doing today manually. So telehealth and artificial intelligence is the way to go. And I have been, you know, trying to portray this to Ministry of Health in India, but I think, they have old thought and old-fashioned belief that they can create these vision technicians and they can create a lower trained person for the public health. First of all, it is an injustice to any public whereby you create different level of healthcare providers to its citizen. Whether I live in Delhi or whether I live in a remote village in India, I should have access to the same health care provider as a citizen of that country. I should not be differentiated because of my financial or because of my demographics. And the government must make it right that they have to appoint it, they have to think of a healthcare provider which can which can meet the need of primary healthcare and which cannot be other than an optometrist. So I think I've tried to cover. If there's any issue, if there's any question, please feel free and get in touch with me if you want to implement telehealth, and I can be of any help to any of you. Thank you so much.
Thank you, Dr. Ajeet, for such a wonderful presentation.
Thank you.
Well, now it's time for the discussion session to begin. Are you ready to take the questions?
Yeah, good.
Okay, I'll be reading out the questions for you. Let me check out the questions that our audience might have raised. Our first question goes as, is there any other way to practice telehealth where there is no any access of internet?
Oh, which is a difficult question. If there is no internet, let me think. There is no internet. No, I'm afraid, because you see, you need internet in the sense that for any conditions to be treated as per the law, as per the Indian laws, you need to see a patient face to face. You need to do two-way video conferencing to prescribe an antibiotic eye drop. Unless it is just a eye drop which is over the counter, which you can buy from the chemist, that a doctor can prescribe without a video consultation. So if it is something which is kind of artificial tears, maybe kind of lubricant, that's the only thing what you can do on a patient who doesn't have internet too. But if you want to go beyond that, I don't think that there is any way of. Only thing, second thing what you do or the doctor can do is attend an emergency, whereby he can talk to the patients on phone. But I think again, a phone would need a kind of bandwidth, whereby he can advise by listening to the symptoms of the patient that this is where you can go for your emergency services. But without internet, I doubt that we can implement this telehealth.
Okay, we have another question, and the question goes as, can you share the AR apps for eyewear?
AI apps for eyewear.
Sorry, sir, AR apps.
AI stands for artificial intelligence or what?
AR apps, I guess you have mentioned augmented reality apps.
Augmented reality apps. You know, augmented reality is such a big subject that if I talk on, because it has an application in every aspect of eye care. If you look at diabetic retinopathy, There's an app called IDX-DR, which diagnoses the refractive, which diagnoses the diabetic retinopathy without uh, any intervention. You can take the image from your retinal camera and send the image to this app. And I'm sure this not only one app, there are so many multiple apps created by different of the different NGOs also, different companies also. That but IDX DR is the one which is approved by FDA for diabetic retinopathy. Then there is an app for OCT evaluation also. Then there is an app in OCT. You can even predict, when the patient will have ARMD. You can also predict whether this patient will develop glaucoma or not in 5 years to come. So there are so many. So there's an app for diabetic retinopathy. There's an app for OCT. There's an app for even red eye evaluation. There's an app for which is for your. If you look at visual rehabilitation, patients with blindness, patients with low vision symptoms, they are getting real benefit for their application of Microsoft, called Microsoft AI. And I would suggest that everyone should read about this, which is called Microsoft Seeing AI, SEEing AI. So this app is so strong that by just looking at a patient who have no vision can recognize a person, because the application has taken the pictures of these all his relatives, all his friends into the software, and whenever that person comes, the person can recognize, the person can be even analyzed whether the person is angry or sad. The person can be analyzed what he is wearing, what kind of clothing he has. At the same time, these apps can read for the patient. They can identify the objects. They can identify the barcodes. So it has so much of we will have a kind of, I think we had a talk on telehealth. We will have a big lecture. We can make a kind of lecture on artificial intelligence applications, because there are so many, and there are so many which are changing the face of eye care. It's unimaginable. From tracking devices, from navigation apps, for reading apps, for magnifying apps, for diagnostic. At least 50 eye health conditions today can be diagnosed by just these applications. And these are not just, I'm talking of, these are done by big companies like Google's, Amazon, and your DeepMind is another big company which have done at least 50 eye diseases you can identify just by taking the picture of the patients. So there's so many, and so such a diverse field that we can talk for a long time on. Even on blindness issue, there's so many applications of artificial intelligence that are coming up, that they're going to change the way we are been practicing low vision in our practices.
So we have another question, and the question goes as, what are the main limitations to practice telehealth in optometry?
The limitation is your mind. If your mind is blocked, you cannot do anything. If you are open, as I told you, it doesn't cost you anything. I can connect to anyone within 5 minutes. I can activate him to or activate her to telehealth within 5 minutes. It doesn't take anything. It just needs an internet connection. It needs just a laptop or a desktop and a will to connect to the patient. It doesn't need any finance. It doesn't need any money to enroll into this. So it just how strong you are, how positive you feel about this. That is what matters. Doesn't need anything. It just needs and I strongly feel that it has to be a part of curriculum for all optometry institutions within Nepal, within India, that the optometrists learn this. When we go to, I happened to go to many schools for doing vision screening. My biggest challenge was the amount of time I wasted in reaching my optometrist. They come from different locations, distance locations. By the time you reach to the school, it's already 10 o'clock, 11 o'clock. Patients, And by the time you're setting up your screening systems, the school is about to close by 1 o'clock. There's another shift. So you hardly use so much of human resource is wasted just in commuting, and the kind of money you waste in transporting the equipment. Telehealth implementation in school screening, in public health can change India's blindness patterns, change the statistics what we are facing today. So I think the optometrist needs to be ready and geared up to adopt this, and there is no limitation. And we can do it, as I mentioned, within 5 minutes. You are ready to provide a consultation to any patient. You should be ready to learn.
Thank you, Doctor, for your answer. Thus far, these are only the questions that are raised by our audience. We will be waiting for a few more minutes if anyone is willing to ask. We have another question by Saurav Ghosh. Good evening, sir. Do you think this teleoptometry can be complaint for a pediatric patient also? And how would you charge patient only teleconsultation charges or the devices uses charges? Also, there is any specific norms from government or authority?
You see, uh, understand one thing. See, pediatric patient could be a person who has a congenital cataract, a person who has leukorrhea, a person who has retinoblastoma. If you can just take a picture, if you are fortunate, or if the child is, fortunate to get access to you, and you are able to diagnose that sitting anywhere in any part of the world, I think it's a big blessing to the family or to the child that you are able to diagnose it sitting anywhere. So my issue goes that there is no limitation that you can, starting from any age, because basically you are looking at the eye of the child. You can, I have done the vision examination of a child from 7 years onward, and come to know that the patient needed glasses. The child needed uh, had myopia of minus 2.5. I've been all, if you look at binocular functions, all the convergence exercises on different, I normally use binocs for my vision therapy, and most of my patients using therapy are children. So vision therapy, prescription of glasses, diagnosing pediatric patient is not an issue. It's, I mean, earlier you do it, better it is for the child, because if you detect amblyopia earlier, you are able to get the results in a better and effective manner. So pediatric population is going to really benefit. Only thing is that the optometry is ready for it to accept the challenge. So there is no such restriction by the government as such that you have. Only thing is that you don't dilate, and we don't dilate in India. We only, whenever there is a dilation, we suggest that you come for a comprehensive eye exam, and we suggest that they should go to ophthalmologist for it. And this is the way I would suggest that everyone should follow the law and practice as per the state or the government guidelines.
Thank you, Doctor, for your answers. We have another question. Vision technicians with optometrists, how you think an optometrist's role can be highlighted in telehealth practice?
You see, optometrists need to see that they need to. I find it very challenging, because our clinical skills, our clinical judgment need to be improved, and this is what I have been trying to portray right from the beginning. That training is the key for telehealth consultation. To improve your clinical skill, you need more experience. You need to try, and you need to think innovatively. You need to not be, you will make mistake, and it is bound to happen in healthcare, that once you are doing things remotely, there could be certain mistakes. But I'm sure that the Our educators, they have a strong responsibility. They have a great responsibility of improving the clinical skills. And I think the vision technicians, unfortunately, the duration of their education is such limited that it will be difficult for anyone to work on overall, because to to provide a good clinical judgment, you need to have good background knowledge of the subject. And in healthcare, I'm very skeptical about use of this half-baked, you know, clinicians whom we try to train within 6 months or within 9 months or within a year. They do more harm to public than doing good, because unfortunately in India, what we look at is the quantity, how many cases, how many numbers, and that telehealth will change that. Today with telehealth, it will the quality which will count. Telehealth will not look at the number of more patients you see, but the quality of your eye care is going to be better if you use good clinicians with good clinical skills. And that is what the challenge optometry profession in India and Nepal will face if they have to emerge as a primary eye care provider to the public.
Thank you, Doctor, for suggesting valuable insights. Well, yes, we have answered almost all the questions till now. Considering the time limits, here I announce the closure of discussion session. I would again like to express my immense gratitude towards our presenter for today and as well to all the attendees for their endurance. Also, I would like to thank all the direct and indirect helping hands for iTalks program. Before wrap up, I request our today's presenter, Dr. Ajeet, to share his few words to our program.
One thing I just want to tell you about technology. I was making today a presentation, and at 7:15, I had almost finished that presentation on telehealth. And immediately I was trying to save it. Something happened in the computer, and all my slides, they just, I couldn't save any of those. And if you just notice it, the slide what I talked upon was an old slide which I had presented about a month back. So technology is something that can disappoint you also, which you as a healthcare provider needs to be ready that there could be challenges in technology. Sometimes when we connect to my patients, I realize that the internet, the connectivity goes down and I'm not able to hear the patient's voice. But then you should be, nervous about it, because technology will have challenges. And what we do is just that when a challenge like this comes, you think what we need to do. So I leave my to video conferencing just for my virtual face-to-face communication, and I connect to the patient on his mobile phone. So we communicate sometimes by face-to-face on one technology and for audio on another technology. Just like what happened today is just that I was a bit, unhappy in the sense that, even the one of your Kapil even pointed out that I was not changing the slide because my presentation, which I had prepared, unfortunately got, crashed just 5 minutes before my allotted time. So technology will have challenge, but we need to make sure that we overcome those. We develop our confidence or clinical skills to the better way, to the most effective way to serve our patients in a rightful manner. Thank you.
Thank you, Dr. Ajeet. It's our immense pleasure to have you.
Thank you.
Herewith, I announce the closure of today's webinar, hoping to see you all again tomorrow. Stay safe, stay connected. Thank you.